Hello, Ed. I'm glad you were able to join us today. And would you like to introduce yourself and tell us your place of business?
Well, thank you. My name is Ed Robbins. I am the Senior Site Director for Mount Sinai Roosevelt, Mount Sinai St. Luke's, Mount Sinai Beth Israel, and Mount Sinai Beth Israel Brooklyn hospitals in the Mount Sinai Health System.
It's quite a title you have there. Thank you for
Well,
joining us today and for helping our students. What is the scope of your work uh, in terms of what the department covers?
well, the department pretty much reaches into every department within the hospital. We do support things, everything from housekeeping systems all the way up to fetal monitors and EMRs and so forth like that. So the scope is wide. There's not too many things in the hospital that IT doesn't touch.
We've been learning about that in school, so it's really good to hear it right from a practitioner point of view. Do you want to
Right.
elaborate on any of that?
Oh, sure. I mean, traditional IT, you think of computers, you go to your desk and that's what you have, but it's much more than that now. There's many things, wireless, cellular, uh, the telephones, the paging systems. There's many things that we support that aren't your traditional. Uh, I walk up to a PC, do my word processing, and walk away.
I'll bet. What do you do with housekeeping? You mentioned housekeeping.
We have a bed tracking system, and basically, when a bed is dirty or needs to be cleaned, nurse puts in some information, and it gets sent to the housekeeping department, and then the housekeeping department dispatches via remotely via computer dispatches the housekeeper to the area that needs to be cleaned. Once that housekeeper's done, they go back into the system, say that they're available to clean another bed.
And you mentioned something about, was it ICU or a NICU?
NICUs and labor and deliveries and so forth like that. We have different monitoring systems and different computer systems that help analyze the data and help provide treatment plans and things like that to the patients in those areas. Recommendations for treatment plans.
Sounds great, Ed.
Mhm.
What does your job entail?
I basically am the liaison between the senior management at the hospitals, each of the individual sites, and the corporate IT department. I report directly to the CIO of the health system. And our IT department supports, he is in charge of support for IT for the Icahn School of Medicine, for the research departments, and 7 hospitals. So he's got a pretty big job right now.
It sounded like you do too, though, Ed, in terms of
Mhm.
your span of control there. There's a lot to cover.
Right. I have 4 in the Manhattan area, Manhattan and Brooklyn area, 4 hospitals.
Wow.
Mhm.
So, how has your agency moved toward the EMR, the electronic medical record?
Well, we have 2 flavors of an EMR, an ambulatory EMR record, and we have an inpatient EMR record. Um, and we are in the process of certifying the inpatient EMR record for meaningful use two. Meaningful use two are some of the goals that were set up by CMS um, that we have to do to make sure we get Medicare funding and so forth like that. Don't get penalized.
I didn't know there was a penalty involved in the EMR.
There are penalties that are involved if you don't implement certain portions of an EMR uh, into uh, into your hospital system. Yes, there are.
Wow.
It started out
Okay, it's good
incentives.
to know.
Yeah, it started out with incentives, and then they had like a little grace period, and then the penalty phase will start if you don't have these things in place.
How long have you been working on that, on the EMR?
Since 1999,
Wow. So
right?
do you see a lot of integration now happening that you haven't seen in the old days?
Absolutely.
Like,
As
does
the
your
technology,
inpatient talk to your outpatient?
Yeah, well, as the technology gets better and better every year, and network speeds get faster and faster, and processors process more, and you can hold more data, you integrate more. Our EMRs integrate, for example, with the radiology system or the laboratory system. It's not just a standalone type of thing. So there are many, many new opportunities to integrate into different things, especially as the technology gets better and better. It's a very exciting field. It's really hard to keep up with, though.
I'm sure. Just listening to you, it sounds like so many things are changing daily there. It's
Well,
great.
with the governmental regulations and with the amount of, of changes within the technology industry, it's just amazing. You can have something in one year and it be obsolete the next. That's a little bit of an exaggeration, but it's definitely it moves very, very fast.
What do you see as the biggest or the major area for growth in IT?
Major area for growth in my particular field is informatics, nursing informatics, informatics with providers and physicians. Um, Not only have we moved away from it being just a traditional IT type of environment when you work with computers and implement systems, we've now partnered with nurses and doctors and clinical informaticists to roll these systems out and to make them better, increase the quality.
And when you say informatics, could you give us an example of that, Ed?
A clinical informatics informaticist, like a doctor that also is a person that helps design and implement new systems as they come out, and they do it not just from a technology perspective, but they do it based upon their clinical background. So they're kind of combining the two to create synergies when they're putting these systems
Now, would
in.
that be considered a software package?
Hmm? It could be software. It could be a new type of hardware. A good example of that would be in the last 10 years, a newly created position has started. Nursing informaticists, clinical medical information officers, a CMIO. So medicine, at least in my field, is integrating with the technology more and more and more.
Sounds great, Ed. Have heard that IT will reduce the costs in healthcare and also cost more for us in healthcare. What is your educated opinion on this?
Well, if you want the newest and the greatest, it's going to cost you more. But every time you make an advancement in technology, the hope is that it increases quality, reduces delays, that type of thing. And so as you gain those efficiencies from doing automating things and so forth like that, and your quality gets better and better, you're able to deliver better patient care, which should reduce your healthcare costs. Um, uh, it is expensive though to buy those systems, implement those systems, and maintain those systems. So it's kind of like a scale.
Who does the weighing?
Well, your patients ultimately, they have to, it's a very competitive market and they have to decide what, the quality that they want, the bells and whistles that they want. They want to be able to book their appointment online. They want to be able to view their lab results online. If you don't offer those, you don't compete with those. That's who ultimately determines the the
But they don't want
dollar.
to pay for it, though, do they?
What?
They don't always want to pay for it.
Well, those are
That's
embedded
always
costs.
that is the cost is always going with the quality you have to weigh.
Correct.
Is has your agency done telemedicine?
We've just started with a little bit of that. We're partners in certain things, but we're just beginning to scratch the surface with that. And I know that with Mount Sinai being the robust organization that they are with regard to research and things like that, um, we are entering into the foray with it, but we're not into it too deep right yet. We've just scratched the surface.
Okay. And what about medical protocols?
My
As your
department would my department would never design medical protocols. The medical protocols would have to be done by a group of physicians or clinical people. Um, we would implement, but all of the protocols are still designed by doctors and nurses and so forth like that. We may
but
create order sets for them,
you develop
but
the order set
they
then to set it into place to make it
correct.
happen. Okay. How does your hospital have a committee to look at the efficacy of IT, to weigh these decisions?
Um, we have several committees. We have from at the top level, we have committees of the board that the board of trustees participate in for IT, all the way down to the site level, where each of the sites decide what is of value of them and how they categorize that value. And so there's levels of committees within there that do judge that, but ultimately the patients judge it.
Okay. So if we have some students who are interested in going into this kind of work, since there is so much demand, how would you, what would you suggest to them?
I would suggest get some strong health background, health management background, so that you understand what you're working with, and strong IT. It never hurts to learn to program and stuff like that before you get into the management and so forth like that. If you understand how the basics work first, it gives you a little bit better understanding when you get into the other things like managing multi-sites or project management or so forth like that. Project management, PMP certifications are great. You could do those online. You could do those also if you have internships and so forth like that. It's very competitive, but it's a very it's booming. A lot of sick people out there. A lot of IT equipment needs to get installed and services.
It sounds
And it
great.
moves leaps and bounds.
That what?
It
I'm
moves
sorry.
with leaps and bounds. It moves with leaps and bounds.
I'm sure it is. We're learning about that and how big IT plays a part in healthcare. The last thing I would want to know is there anything else for health science majors you think we haven't covered and they need to know?
No, I think that the questions were very good, very well rounded, and they covered most of the areas. Just make good grades, stay in school.
Thanks, Ed.
It's
I really appreciate your help with this. And
all
I
right.
look forward to working with you again. The questions were from the students, by the way, and I know they did a really good job in coming up with them.
They
Thanks
did.
again,
They
Ed.
did. You're welcome.